Via phone from the San Juan Regional Heart Center this morning. Two local cardiologists are on the phone with me right now. Dr. Jude Gabaldon is joining us. Good morning, Dr. Gabaldon. Good to have you back on KSJE.
Good morning. Thanks for having me.
You bet. Also, Dr. Mac Kerrow is also joining us this morning. Dr. Mac Kerrow, good morning to you.
Hi, thanks for inviting us.
You bet. It's great to have both of you on the program. Great knowledge from both of you, and looking forward to hearing from you. This is the month of February. We talk about Valentine's and hearts, and of course, Heart Month. And for you two, it's a little bit more professional than that because you are dealing with hearts each and every day in the work that you do at the San Juan Regional Heart Center. So, Dr. Gabaldon, let me start with you, and can you give us kind of an update on some of the things that the Heart Center is seeing these days? Is it the usual heart attacks and things like that, or give us an update if you wouldn't mind?
Yes, it is a lot of the same things that we continue to see all throughout the year. People with chest pain, chest pressure, shortness of breath, swelling in the legs that could represent heart failure. What we're seeing more this year, because of the coronavirus pandemic, is a lot of people presenting late to the hospital for cardiovascular emergencies. So this February, this Heart Month, we are really still getting out our message of early care saves lives, saves muscle, and the hospital is safe. If you have chest pain or chest pressure, you should call 911. Unfortunately, we have seen too many people stay home when they have had cardiovascular symptoms. That results in a delay of care, and that really puts us behind the eight ball as we look to get these people back to health and living happy.
Understood. Thank you. And I've always heard from your colleagues at the San Juan Regional Heart Center that time equals muscle, especially when it comes to the heart, correct? So if there's a delay in care, could that possibly damage the heart even more, I guess, if you're not getting care right away?
Absolutely. And that's what we're seeing. We're seeing folks that have chest discomfort syndromes. I use chest discomfort because it can be anything. It can be a burning sensation, a left-sided chest pain, a right-sided chest pain, back pain, shoulder pain, jaw pain. So it encompasses a lot of things. But a lot of people, unfortunately, are staying home, having their heart attack at home, and not coming to the hospital for a couple of days later. And it's difficult to see, knowing that if they would have come into the hospital early, we could have done more.
Understood. Thank you. Dr. Mac Kerrow, let me turn to you a little bit. You are an interventional cardiologist, and so I imagine the same type of thing is what you are dealing with as well, correct? And just the time that folks are waiting during this COVID-19 and not seeking out care immediately when the symptom happens?
Yeah, I would echo what Dr. Gabaldon just mentioned, and that this is really a nationwide and maybe even a worldwide phenomenon where, especially during the start of the pandemic, early last year, many hospitals across this country and elsewhere saw a decrease in patients presenting with heart attacks compared to the usual number of patients that we see. And the patients that did present presented in much worse condition. Part of that was due to waiting, because as you had mentioned, the phrase is time is muscle, and the sooner someone can get in and get a blocked artery open, the better the chance there is of rescuing heart muscle. So we're starting to see some improvement in that trend. I think people are becoming a little more confident now about showing up earlier when they do have cardiac symptoms. But all along, there's been the overlying fear that they may be at risk for catching COVID if they should come into the hospital. But really, when you step back and look at the whole picture, you're actually doing yourself a harm by waiting. If you have cardiac symptoms, the risk of not doing well from a cardiac standpoint probably exceeds the risk of not doing well from potentially catching COVID.
Right, understood. And talk to me a little bit, Dr. Mac Kerrow, if you would, about the recovery. And I know every every heart attack is different, every patient is different, but that delay, if it, I guess, causes more damage to the heart, that means more of a recovery, or maybe less optimistic recovery options for the patient if there's so much damage done to the heart muscle during some type of heart attack?
Yeah, exactly. I mean, if someone is having a heart attack and they're losing heart muscle because of poor blood flow to the heart, once that muscle is lost, the chances of getting it back are extremely low. There's a very limited amount of time that heart muscle can survive without adequate blood flow. And when arteries are opened up using balloons, angioplasty or with stents, there's a golden window of time in which that may provide some benefit. And if someone doesn't get in early, they run the risk of ending up with a weak heart, and that's generally known as congestive heart failure, and then would be dealing with that for the rest of their lives. And of course, that means different medicines to treat that. It may impact that patient in terms of their functional capacity, their ability to exercise, to do their daily activities, their overall comfort level, and that sort of thing. And generally, patients who present late to the hospital after having the start of a heart attack do worse. That's been well documented even before the COVID epidemic. And they do worse because they end up with weaker hearts. They may be at higher risk for having bad heart rhythms. Their hospital stays are usually longer. And then their ability to get back to what they were doing before may not return or may be very limited.
I see. Thank you very much. And Dr. Gabaldon, let me come back to you a little bit about what that might mean, I guess, for the patient, because often we hear about, when a patient presents themselves, they usually don't just have one problem necessarily, like a heart attack or heart problems. That may cause other issues with that patient, and maybe respiratory or other types of things, or circulatory problems. Is that something that you deal with as well, or that you see when patients present, or the recovery could cause other problems as well if the heart is now weakened because of a heart attack?
Yes, we do see patients with weakened hearts, patients with decreased blood flow. The coronary heart disease frequently comes with other diseases as well, so diabetes, high blood pressure, high cholesterol. When somebody comes in with a heart attack, we treat all of these things. When somebody comes in with congestive heart failure, we treat all of these things. And the good news is we can do a lot with folks who've had heart damage and folks who've had a weakened heart muscle. With special medicine cocktails, we can work on getting their heart's pumps function strong again. We can work on getting them active again and doing everything that they want to do. That is our goal as cardiologists. It's getting people active, getting people back to where they want to be functionally, and getting them symptom-free. And the good news is while it is scary when folks have heart attacks, heart damage, or congestive heart failure, we have very good medicines, very good techniques, and advanced therapies that we can really get people feeling better regardless of their pumps function. And so all is not lost if you come into the hospital with a heart attack. All is not lost if you stayed home and you had chest pain and now you're feeling weak or congested. We have a lot of things we can do to make you feel better. The thing that complicates matters is that the symptoms are so varied between patients. If you call a family member who's had a heart attack and ask them what symptoms they had to see if you're having the same types of symptoms, it's completely variable. And so it's just a matter of having an increased, what we call in the medical profession, index of suspicion that this could be your heart. And so I tell a lot of my patients, we would rather see you in the emergency department or in the office early and tell you you are not having a heart attack rather than seeing you late telling you you've had a heart attack. So I like seeing patients who are concerned about the symptoms they're having before they're having any obstructive or blocked heart artery problems. Because ideally we want to keep people healthy.
Of course. That's right. And Dr. Gabaldon, talk to me a bit about the type of patients that you're seeing. And I guess the point being, we kind of have a stereotypical view of the typical heart attack patient, if you will, that's older, maybe a man. But this really is impacting a lot more than just that. I know that women have heart attacks. We don't always think about that. Younger people, at least to my recollection, are also suffering from heart damage and heart attacks as well. And please correct me if I'm wrong, but it really is becoming more and more common, unfortunately. Is that what you're seeing?
Unfortunately, we are seeing that as a trend. We've had 40-year-olds in the hospital with heart damage. We've had 30-year-olds in the hospital with heart damage. That is much more rare than seeing an 80-year-old or a 70-year-old with heart damage, but it's not unheard of. And again, it's all based on symptoms. If you're 40 years old and you're having chest pain, it doesn't register with you as it being a blocked or narrowed artery because you are young and it is rare. But like I said, we would rather see you in the hospital, see you in clinic, make certain it's not your heart, and keep you healthy rather than respond to a change in your health.
Of course. Yes, thank you. Dr. Mac Kerrow, let me turn to you a little bit about women and heart disease and heart attacks. And again, it's something that we don't always talk about maybe as much as we should, but women are still make up a good percentage of patients that are having heart trouble and heart attacks, correct?
Yeah, absolutely. And I'd like to expand on one thing Dr. Gabaldon mentioned, and that was the two groups of patients that are most likely to have unusual or atypical symptoms for a heart attack are the elderly and diabetics. And in this part of the country, we have a huge diabetic population in the Native Americans and also in the Hispanic population. So one thing I've learned over the years is that you cannot rely just on chest pain in a diabetic. Diabetics will frequently have unusual or atypical symptoms and may not have typical chest pain with a heart attack. And those other symptoms might include shortness of breath, sweating, fatigue, what some people might consider indigestion. And that's why it makes it so hard sometimes to pick up coronary artery disease early in the diabetic population. And similarly, women tend to present a little bit later than men do with coronary artery disease, but they may also not have typical symptoms. Everyone thinks of the classic crushing chest pain, but you really can't hang your hat on that in a lot of these different patient groups. You have to have a high index of suspicion. So again, the groups that are most likely to have what we call a silent heart attack and not know about it are generally the diabetic population and a lot of elderly patients. So that makes it a challenge.
Understood. And I think what I'm hearing both of you gentlemen say this morning is better safe than sorry when it comes to chest pain or discomfort, to get it checked out. And if it's just a bad lunch, it's just a bad lunch and not anything more serious.
Right.
Very good. And Dr. Gabaldon, let me come back to you and ask you again with the San Juan Regional Heart Center in Farmington, but you have also, is my understanding, you've expanded into the Southwest Colorado area as well for patients in that part of the listening area?
Absolutely. San Juan Regional Heart Center offers comprehensive cardiovascular care. We also offer peripheral procedures, so opening of arteries in the arms or legs that are blocked, and vein procedures. We do stress testing, ultrasounds, and diagnostic testing. This is the first time you've heard from Dr. Mac Kerrow. Dr. Mac Kerrow has actually just joined our group and has only been in Farmington for the last 2 months. He has an open patient panel and is looking to establish and grow our practice. He is also going to be the one who's doing outreach to Durango, along with Dr. Cheney, who's already in Durango, and reaching out to our patients in Cortez in southwest Colorado. So we are very much interested in growing our practice and bringing expertise to the whole Four Corners area. Farmington, of course, as our home base, but all of southwest Colorado as well.
Very good. Thank you, Dr. Mac Kerrow. Welcome to San Regional Heart Center, and welcome to the area. It's great to have you with us then.
Thank you. That's been a very enjoyable experience. So I'm glad to be here.
Very good. Well, gentlemen, I want to end the program. We still have a few minutes remaining on a more positive note, and that is maybe some advice from both of you on how we can maybe keep our hearts healthier. And no offense, but to avoid seeing you for a heart problem. But what can we do? Dr. Mac Kerrow, do you have some advice of what we can do to maybe help our hearts become healthier? Maybe we've kind of done some bad habits, and can we still change our ways and maybe not be on a path to a heart attack or heart problem?
Yeah, absolutely. I always tell patients that the patients I see that tend to do the best are the ones who exercise regularly, and I firmly believe that. So the current guidelines from the American Heart Association are that everyone should try to get a minimum of about 150 minutes of aerobic activity each week, and that could involve any type of exercise: walking, running, riding a bike, swimming, anything, as long as you get up and move. So I think that's extremely important. And then diet-wise, everything seems to be moving more towards what's called the Mediterranean type diet, which is a diet that has not very much red meat in it, a lot of plant-based protein, whole grain products, low-fat or no-fat dairy products, a lot of fresh fruits and vegetables, fish, nuts, beans, low intake of sugary substances like soft drinks, refined carbohydrates, that sort of thing. So I think if people switch to that type of diet and try to get exercise regularly, those two things alone, in addition to not smoking and trying to keep the weight down, are really what most people need to do.
Very good. And I would assume by doing some of those things, your weight would come down, or at least stay down, right? If you're eating healthier and getting out and moving more, that by its very nature would keep some of the extra pounds off.
Yeah, absolutely. And I think the high carbohydrate diet and the American diet, my own opinion is that's a major factor with weight gain. And, if we can try to get away from the high sugar intake and that sort of thing, that really will help with weight loss.
Understood. Thank you. Dr. Gabaldon, let me turn to you. Same kind of question. Do you have some advice that you give to your patients about maybe what they can do to avoid heart problems and maybe get their hearts healthier, as Dr. Mac Kerrow was explaining? Is it along the same lines?
It is along the same lines. As you may recollect, I think we spoke about this a couple of years ago. Definitely exercise, definitely quitting tobacco products if you use tobacco products, maintaining a healthy weight. And I've simplified my diet recommendations to just eating more vegetables. The average American doesn't eat enough servings of fruits or vegetables. And so I just say eat more vegetables, walk for exercise, walking 30 minutes a day, 5 days a week. You don't have to buy equipment. You don't have to join a gym. Get out, enjoy the sunlight, the spring season as it comes, and walk 30 minutes a day, eat more vegetables.
All right, that seems like an easy thing that all of us can do, and I don't know why we're not all doing that more. But I know some people would say too, if you're going to a store, we're not doing too much of that these days. But if you're walking, maybe park a little further away from the door and get in your steps that way, and that's something that's probably pretty easy to do as well, right?
Absolutely.
Yep.
Very good. Well, excellent. Well, final thoughts from both of you gentlemen on the month of February and what all we can do. Again, we know, as you mentioned, Dr. Mac Kerrow, we have a high incidence of diabetes in our population. So again, those folks should be certainly aware of some of the extra risks that they may have. So what can we be doing moving forward here in the month of February? Dr. Mac Kerrow?
Well, as we mentioned, just being aware of lifestyle modification. So much of heart disease is due to lifestyle habits, and many of those things can be changed, and the heart disease can be preventable. And a lot of the stuff that we do, we're seeing the end stages of the disease, whereas if the disease had been addressed years earlier by changes in diet, exercise, weight loss, no smoking, we wouldn't be in the situation where we're having to deal with the end-stage complications of coronary artery disease. So it really boils down to motivation and realizing how important it is to have exercise and a healthy diet.
Very good. Dr. Gabaldon, same question to you again about what words of advice we can leave our audiences with this morning.
I think in addition to those things already stated, if you think you're having symptoms, and realizing that your activity is a little stress test you do on yourself every day. And so if 2 weeks ago you were able to walk around the block without stopping because of breathlessness or chest discomfort, but this week you're stopping to catch your breath or because you're having some chest discomfort, that change of symptoms is something that should prompt further evaluation. That's easier to tease out when you are active. If you are active, you will know that there's been a change in your activity going forward that needs to be evaluated. And so all of those things, plus being mindful of your symptoms, what we'd recommend and look forward to bringing people's attention to for the month of February.
Certainly. Well, I think that's great advice from both of you, and I do think the whole, unfortunately, COVID-19 pandemic has made us more aware of our health and maybe some of our symptoms and things along that line. And so hopefully folks are more aware of their bodies and those maybe small, seemingly insignificant changes, but they could be very significant ones. So I think the advice that you're giving, both of you, is great and spot on this morning. So thank you very much, both of you, for joining me on the program this morning. I appreciate it very much. Dr. Jude Gabaldon